We're good now. Yeah.
We are here with Cecilia Ruben from Stockholm Environment Institute to talk about one of their initiatives that they're beginning in Bihar. Thanks, Cecilia, for being here. And can you tell us why you chose Bihar for the initiative?
Thank you for inviting me. I'm very pleased to be speaking to you. I know the work that you're doing here, and it's very valuable. The reason we ended up in Bihar is, like in many instances, it's a coincidence. The money that my institute, SEI, has received from SIDA after a grant application is for partnership collaboration. And the partner in India is WASH Institute. They have their headquarters in Tamil Nadu, but the executive lives and works in Patna, and therefore we decided to have the project there. And of course, the topic matter is very much related to the situation in Bihar. We're dealing with sanitation in flooded areas, which is a topic that has been very little dealt with, in fact, and we hope to come up with some solutions that can be applicable not just in Bihar, but elsewhere in areas that are flooded. And the flooding situation is sometimes forgotten, and many people around the world suffer from these conditions year after year. And then, of course, there are the big emergencies and huge floodings. They get a lot of attention, and then perhaps they're not so well prepared for the sanitation issues as they should be, and we hope to be able to contribute a little bit towards that work as well. So these are the long-term perspectives.
So that's very interesting, because when you look at floods, you typically talk about embankments, you talk about food, you talk about clothing, but sanitation and good water are often ignored. So can you also take us into what you plan to do in the project, what the main aims are and how long it's going to be?
Okay, yes, we will. It's a 3-year project. It has just started, and we're starting with an assessment of the situation related to sanitation, also health in Bihar. There's no such study yet done, so that's the initial step. We know the coverage, sanitation coverage is exceedingly poor, and of course there's no systems that are really functional during flooded periods. So we are looking at action research here. We'll do some development of technology. We will do that through pilot projects. The pilots will take place in schools, in urban settings, and in rural settings. There will also be a communal toilet in an urban area. So we will test different technologies, and of course pilot is not just building a toilet, it's much more. It implies sensitization of the community, capacity development, implementation phase, and a follow-up phase. The software aspects are equally, if not more important than the physical, the hardware input. So what we will do is not just test different technology, we will also work on knowledge development, knowledge management, outreach and communications, and we hope to be able to work on policy promotion as well. So it's a rather comprehensive approach to these issues, and we're very much looking forward to getting engaged and rolling up our sleeves to start the work. And you asked about the different technologies, and we will test. We've been working with urine diversion to a great extent. We want to not just provide sanitation services, but we see that it's important to be able to reuse the nutrients and the soil enhancing capabilities found in human excreta. But of course, this has to be done under safe conditions. So it's very important that we follow rules and make sure that we have barriers so as not to spread any diseases. But of course, needless to say, anything is better than open defecation. But Our aim is really to find systems that are workable and where we, in a safe manner, can reuse the products, the urine and feces, and all the good that they provide.
Yeah. So if so, you've been talking about technology and you've been talking about ecological sanitation. So it's been tried before, but are there challenges in putting that kind of a system in flood-affected areas?
Well, yes, there are some. The challenges are obvious. Water will rise. I have to admit, I'm not yet familiar with how much water rises, but I assume it's different in different communities. But it's a substantial rise of the water level. Also, it remains for a period of time. So, great challenges. You need to be above ground. You need to enclose the compartments, the chambers or the tanks that you're collecting the products in, and you need to anchor them in the ground so they don't float away. So there are many challenges, and we are. I'm not a technician, so I'm a generalist in excuse me, in sanitation. So I can only tell you that we will be trying different types of technologies. We will try perhaps some innovative systems, and we're now looking at one particular system that has been developed in Sweden. We're looking at another one that comes from France, and the idea here is that you don't divert the urine, but you collect urine and feces together, which I would say simplifies matters a little bit. Probably less work in training people. Also, if you have guests coming to your home, there are fewer risks of messing up if you don't have urine diversion. But and one particular system, it's called the Swedish one. I know a little bit better than the French one, but we're going to look more closely into the details of these later this year. So if I have the opportunity to talk to you again, I'd be happy to explain more. But just to tell you briefly, the system, it's called Compostera, and it's been marketed in Sweden, in the US. I think there are two small pilots here in India. But the idea is to collect urine and feces in a tank, and for a household of 4 persons, say, you have a tank that's a little bit over a cubic meter. So the idea is then to have, with this tank comes and the toilet looks very nice. It's a whole system, the toilet seat, the riser, and you have a fan connected to a chimney. So this is a very important feature of this particular system. So you need electricity, but of course you can have solar cells as backup in the case of a poor electrical supply. But the urine and as well as the feces will create quite a bit of liquid in the tank. The idea is that the liquid will be nitrified within the tank, and you untap water at the other end of the tank, and not the water but the liquid, and that liquid contains all the nutrients that are in urine, but it's something happens in the process, so it doesn't have any smell, and also the pathogens have been killed off. So it's a safe product, and we want to study the matter a little bit more closely. We want to see what the dimensions for such an installation would be for public toilets, say. So we're working on this, and I'll be very happy to tell you more about these ideas as we move along. And so the part of this project is also the reuse of the nutrients and the soil enhancing capabilities. But with that particular solution, there is very little solids. For a private home, I understand it only needs to be emptied after 30 or 40 years use. So very little of that part, but we want to encourage cultivation of vegetables in kitchen gardens, and so there will be some training to that effect as well as part of the project.
Thank you, Cecilia. Thank you for talking to us and telling the India Water Portal about your new project. We will definitely follow your work with interest and hopefully meet again so we can chat on this again. Thank you.
Thank you so much, and I hope you will be able to catch my colleague Prakash Kumar as well, as he's a very key person in putting this on the road. And thank you so much.
Thank you.
Did we get the sound?
Yeah.